We turn back to the statewide mask mandate issued by Governor Polis that took effect at midnight. Many questions involved that mandate, including some people being medically exempt from wearing masks. So our 9 Health expert, Dr. Payal Kohli, who's worn a lot of masks in her day, talking about what does make people medically exempt and what strategies they may use to still wear a face covering. So, well, let's just start some of the medical conditions that might prevent someone from safely wearing a mask.
So, Tom, there really aren't all that many medical conditions that actually preclude somebody from completely wearing a mask. Now, there certainly are some that could make it challenging. And if you have one of these conditions, I would recommend talking to your doctor. So the first and most obvious one is those who have lung disease. So lung diseases like COPD and asthma can obviously increase the work of breathing. And then if you're wearing a mask, that can exacerbate it further. And this also applies to those people who may be on chronic oxygen therapy. The second is actually having something physically different about the anatomy of your face, whether it's that you've had a recent surgery or whether that you've had facial trauma and may have abnormal anatomy on the face. The mask may not fit or may not be able to be worn. The third is if you have a psychiatric condition like anxiety, severe claustrophobia, or post-traumatic stress disorder, this can certainly make it more challenging to wear the mask. And then I would add to that is a neurological conditions like a neuralgia or abnormal sensation on the face that can make it painful to wear a mask, or those who have cognitive impairment. Now, this is by no means an exhaustive list, and there could be other medical issues that could preclude wearing a mask. So if you think you're somebody who is medically exempt, I would strongly advise you to talk to your doctor first before you stop wearing a mask or decide not to wear the mask.
It sounds like many of those people might actually need to be stay-at-home people during a pandemic right now anyway, that the mask isn't really an alternative for them. They should be at home.
Well, that's exactly right. And a lot of the medical experts are actually saying that if you're somebody who absolutely cannot wear any kind of facial covering, then the safest place for you is really in your home. Because to your point, masks not just protect the people around you, but they also protect the wearer. And a lot of the people with these types of medical conditions, such as those with lung disease, are some of the highest risk for complications with COVID. So they're the ones who really should be wearing those masks and protecting themselves. But there are some alternatives or things you can do if you can't tolerate a mask. So face shield is a great alternative for those people, particularly those who may have claustrophobia or problems with breathing from the mask. You can also take breaks often. So prolonged wearing of the mask is really what people can't tolerate very much. So what I would recommend is, short periods of time wearing the mask, and then try to find a mask that's not made of synthetic material, because that's a lot less breathable. Maybe use a cotton mask or one of those surgical breathable masks.
Well, I want to ask you about this. We hear about masks causing CO2 poisoning. Is that legitimate? That is something that can happen?
This is really popular on social media, and I'm glad you brought it up. So in healthy adults, this is absolutely a myth. Now, it is true that when you're wearing a mask, you're rebreathing some of your own carbon dioxide. So your carbon dioxide levels increase slightly, but your brain tells your breathing to adjust. You just breathe a little bit faster, and the levels come back down. So there's really no toxicity or retention of carbon dioxide that occurs in normal, healthy people. Now, this may occur in people who have lung disease. So again, if you're one of those COPDers or have asthma, you may want to talk to your doctor about whether it's safe for you to wear a mask. But at this point, for most of us, the biggest side effect of wearing a mask is just realizing that you have bad breath because you're smelling your breath all day long.
I also don't like the peripheral vision. I lose a lot of my downward vision. That seems to be a bother for me, but it's a very minor complaint. But we certainly hope people will, in fact, wear masks and hopefully get our pandemic on its way. Dr. Payal Kohli, I hope you have a great weekend. It's been great talking with you this week. Thanks.